Welcome to the 2023 Open Enrollment presentation for UC San Diego retirees. My name is Ronisha Roberson, and I am the Interim Healthcare Facilitator for UC San Diego. I will be highlighting some of the plans and the changes for the coming year. This presentation will discuss Open Enrollment Basics, Medicare Fact Sheet, the 2023 rates, Medicare and UC Blue and Gold, Medicare and Kaiser, the Anthem PPO plans, VIA benefits, the non-medical plans, member ID cards, resources, and questions. Our open enrollment brochures were mailed out starting on October 19th, so you should have received them in the mail by now. The university pulled your mailing address information in September of this year. If you moved or changed your address after this date, you will need to log into UC Raise and view your booklet online. The first booklet on the left was mailed to UC San Diego actively working faculty and staff. The booklet in the middle was mailed to UC San Diego retirees living in California and retirees living outside of California if you have a family member that is not eligible for Medicare. The booklet on the right was mailed to UC San Diego retirees living outside of California, and all family members are enrolled in Medicare. On the inside of your brochures, you can compare your plans and the costs. As a retiree, your booklet has a special number printed above your name. This number signifies or indicates the maximum number UC will contribute towards your medical and dental premium. If you have a 100 listed above your name, the premiums listed in the booklet apply to you. If you have any numbers less than 100, the premiums listed do not apply to you, and you will need to log into your UC Raise account to find your premiums for next year. Your medical plan premiums are listed in your booklet, starting on page 6. The premiums listed are for retirees eligible for 100% of the maximum UC contribution. Many retirees want to know if they are eligible for the Medicare Part B reimbursement. A retiree is eligible for the Medicare Part B reimbursement if their premium is zero. So let's quickly discuss the Part B reimbursement. If you're eligible for one of UC's Medicare coordinated medical plans, it's possible that you'll get a portion of your Part B premium refunded to you. That's because the amount UC contributes towards your retiree medical benefits is sometimes higher than the total cost of the premium. If this is the case, the university will refund part of the amount that you pay for your Medicare Part B premiums. This reimbursement is added to your UCRP monthly pension benefit or sent via check to eligible Savings Choice members. Open enrollment is the time to consider your options for next year. Are you satisfied with your current medical and dental plan options? Have you recently married or need to add or remove a family member? Are you aging into Medicare next year? Have your health needs changed, or do you need more flexibility? If you previously suspended your health plans, do you need to unsuspend? This is the time to make changes. If you decide to change plans, it's important for you to know that there are no pre-existing condition exclusions. If you need to make open enrollment changes, they must be completed by November 18th at 5 p.m. Pacific Standard Time. This is a firm deadline, so if you live somewhere outside of Pacific Standard Time, please make note of the time deadline to ensure your changes are complete. Do not confuse UC's open enrollment dates with Medicare enrollment dates. Open enrollment for UC begins on October 27th and will end on November 18th. Medicare's open enrollment began on October 15th and will end on December 7th. Please do not get these deadlines confused. All changes become effective on January 1st, 2023 for both Medicare plans and UC plans. If you are on recall or a rehired retiree and have UC's retiree health coverage, you will receive a Medicare survey. Please complete the survey and return the survey as instructed. When the form asks if you are working, the answer is yes. When the form asks if you have group coverage through your employer, the answer is no. If Medicare is not reflecting as primary, call Medicare Coordination of Benefits Office at 1-855-798-2627 and provide your retirement date. What happens if you do nothing? If you are satisfied with your current health plans and do not make any open enrollment changes, your current plan selections will automatically continue for next year. There are many tools you can use to help you with open enrollment. To get started, log on to ucal.us/OE, then click Get Started. You would then click on Retirees. There is also a Medical Plans tab. Click here to find the plan changes, compare plans, and compare the plan costs. When you are ready to make changes, click on UC Raise from the UCNet Compensation and Benefits page. If you have a form to complete, you can upload those forms onto your UC Raise account. You can also fax or mail your forms via USPS. However, UC Raise Upload is the preferred method. Once you are logged into UC Raise, click on Open Enrollment. The second step is to click the Retiree Insurance button. Then review your current enrollments. If you would like to make changes, click the Open Enrollment button. If you need to add a family member, click on the Add Remove Family Member tab after you get into the Open Enrollment section. If you need to remove a family member, you can make that update here as well. To find out what your premiums are for next year, click the Calculate Plan button circled in red here. Retirees having problems logging onto UC Raise with their computer or locked out of UC Raise can call RASC at 800-888-8267 to make changes over the phone. You can also complete the UBIN 100 form to make changes. If you have Medicare, you will need to complete the Medicare form according to the plan you will select for next year. For Anthem Blue Cross plans, you would use the UBIN 123. For Kaiser Senior Advantage, you would use the UBIN 127. For UC Medicare Choice PPO, you would use the UBIN 121. You can fax forms to RASC at 800-792-5178 and they must be received by the deadline. You can also mail forms to RASC and it must be postmarked by the deadline. Make sure to review your confirmation statement from UC Raise to ensure it reflects the changes you wish to make. And remember, if you are not satisfied with the plan you choose this year, You can always change plans again during the next open enrollment. There are no changes to the medical vendors and plan offerings for next year. For our non-Medicare plans, we have the PPO plans administered by Anthem Blue Cross, UC Care, Core, and the UC Health Savings Plan. We have an HMO plan administered by HealthNet, UC Blue and Gold, and Kaiser Permanente HMO. We have 3 Medicare supplement plans administered by Anthem Blue Cross, UC Medicare PPO, UC Medicare PPO without prescription drugs, and UC High Option. For Medicare retirees living within California, we have 2 Medicare Advantage plans, Kaiser Senior Advantage and UC Medicare Choice, administered by United Healthcare. UC continues to offer a Medicare Coordinator Program through VIA Benefits for Medicare retirees residing outside of California. On the far right are the non-medical plan options for next year. Delta Dental, Vision through VSP, RAG Legal, Life Insurance through Prudential, and Pet Insurance with Nationwide. Depending on where you live will determine your options for next year. Plans listed in black print are the non-Medicare plans. Plans listed in red print are the Medicare plans. Medicare Fact Sheet. The Medicare Fact Sheet can be found on UCNet. This booklet will cover Medicare and what UC requires of you when you become eligible for Medicare. UC requires all retirees over the age of 65 to enroll in Medicare. If you are eligible for premium-free Part A, you must enroll in Medicare Part B. In order to enroll in a UC-sponsored Medicare plan, you must enroll in both Part A and Part B, and your Medicare card must reflect both. Failure to comply with this requirement will result in penalties and permanent loss of UC-sponsored medical coverage. There are 2 exceptions to this, which are those who retired prior to July 1991 due to them not paying into Social Security, and retirees who live outside of the United States where Medicare is not required. However, for those who reside outside of the United States, UC will require you to enroll in Medicare once you move back, and a Medicare late enrollment penalty may be assessed by Social Security. Are you aging into Medicare next year? This is the time to review the Medicare plans and make sure you are in the non-Medicare plan that coordinates with the Medicare plan you wish to enroll in. If you are currently enrolled in UC Blue and Gold, once you become Medicare eligible, you or your family member will go into UC Medicare Choice PPO. If you are currently enrolled in Kaiser Permanente, your UC Medicare family members will be enrolled in Kaiser Senior Advantage. For Core and UC Care, your Medicare family members will be enrolled in UC Medicare PPO. For the UC Health Savings Plan, you must choose from one of the other Medicare plans, as the UC Health Savings Plan does not coordinate with Medicare. Medical Plan Premiums. UC premiums are deducted from your UC pension. Medicare premiums are paid by you either out of your Social Security income, through Medicare Easy Pay, or through quarterly billing. There might be a Part B reimbursement, which is a credit on your UC pension check, and it's only available to those in the least expensive plans. Please note that these premiums are separate. UC does not control Medicare premiums and vice versa. 2023 retiree premiums. You will see an increase in premiums this year because, like most employers, UC has experienced a trend toward higher medical premium costs due to rising healthcare prices and increased utilization of medical care. Here are the premiums for 2023 non-Medicare plans based on 100% UC contribution. For UC Blue and Gold, single coverage is $270.83. For two adults, it's $620.27, and for family, it's $836.94. For Kaiser Permanente, single coverage is $189.91. Two adults is $450.34, and family is $602.27. For the Health Savings Plan, single coverage is $168.11. Two adults, $404.56, and family is $539.05. For UC Care, single coverage is $355.49. Two adults is $798.05. And family is $1,082.44. And for core non-Medicare retirees, there's still a zero premium. Here are the rates for the Medicare plans, also based on 100% UC contribution. For UC Medicare Choice, for both single and two parties both on Medicare, there is a zero premium. There is a Part B reimbursement. For single coverage, it's $84.01, and for two-party coverage, it's $168.02. For Kaiser Senior Advantage, for both single and two-party coverage, it's also a zero premium. There is a Part B reimbursement. For single coverage, it's $119.70, and for two-party, it's $239.40. For UC High Option, single coverage is $210.80, and two-party coverage is $421.60. There is no Part B reimbursement for High Option. For Medicare PPO, single coverage is $116.63, and two-party coverage is $233.26. There is no Part B reimbursement for Medicare PPO. For Medicare PPO without prescription drugs, there is no premium for single or two-party coverage. There is a Part B reimbursement for single coverage of $170.10, and for two-party, $340.20. These are the rates for someone who is over 65, retired, but not eligible for Medicare. Again, these rates are based on 100% UC contribution. UC Blue and Gold single coverage is $103.61, and two adults is $294.62. Family coverage is $377.51. For Kaiser Permanente, single coverage is $76.71. Two adult coverage is $170.93, and family coverage is $232.29. For the Health Savings Plan, single coverage is $77.47. Two adult coverage is $172.49, and family coverage is $234.48. For UC Care, single coverage is $255.78. Two adult coverage is $607.36, and family coverage is $811.98. There is no premium for core plan for a non-Medicare retiree over the age of 65. UC Blue and Gold and UC Medicare Choice. There are no structural changes to the UC Blue and Gold plan or the UC Medicare Choice plan. There has been an enhancement to the UC Medicare Choice plan with 3 added features of 28 post-hospital discharge meals and 12 one-way trips to and from follow-up appointments. Also, they have added the Personal Emergency Response System by Lifeline, free of charge for UC Medicare Choice members. When a retiree is enrolled in UC Blue and Gold and becomes eligible for Medicare, they must complete the UBIN 121 form and return it to RASC. Then the retiree or the family member will be enrolled in the UC Medicare Choice PPO plan. The main difference between these two plans is that UC Blue and Gold is an HMO and UC Medicare Choice is an Advantage PPO plan. UC Blue and Gold has added the plan enhancement for infertility benefits. The diagnosis and treatment of infertility, artificial insemination, and medical treatment is currently covered at 50% coinsurance with no lifetime limit. For the 2023 plan year, they are adding up to 2 cycles of IVF, GIFT, and ZIFT at 50% coinsurance. This is a lifetime limit of 2 cycles per member. Kaiser Permanente and Kaiser Senior Advantage. There are no major structural changes to the Kaiser Permanente or Kaiser Senior Advantage plans. The only change is the Kaiser plan is eye exams are now covered at a 0% copay for Kaiser Permanente and a $20 copay for Kaiser Senior Advantage. Also, the out-of-pocket max for Kaiser Senior Advantage is now $7,400. Everything else remains the same. For those currently enrolled in Kaiser Permanente, to enroll in Kaiser Senior Advantage, you must complete a UBIN 127 form to assign Medicare to Kaiser Senior Advantage. Kaiser Permanente HMO has added the plan enhancement for infertility benefits. The diagnosis and treatment of infertility, artificial insemination, and medical treatment is currently covered at 50% coinsurance with no lifetime limit. For the 2023 plan year, they are adding up to 2 cycles of IVF, GIFT, and ZIFT at 50% coinsurance. This is a lifetime limit of 2 cycles per member. Some other enhancements to the Kaiser Permanente plan is male condoms are now covered at a 0 copay. Breastfeeding supplies are also covered at a 0 copay, and breastfeeding services, which previously had a $20 copay, is now a 0 copay. Anthem PPO plans. Navitus Health Solutions will remain as the administrator of pharmacy benefits for the following plans: Core, UC Care, UC Health Savings Plan, UC Medicare High Option, and UC Medicare PPO. These are the plans that include pharmacy benefits. As the pharmacy benefits manager, Navitus sets clinical policy and guidelines for medications and for the processing of pharmacy-related claims. Navitus offers convenient options for filling prescription drugs that members are accustomed to, including participating University of California Health Medical Centers, a large retail network such as Costco, CVS, Walgreens, Walmart, Safeway, and Vons, mail order delivery through Costco, and access to specialty medications through Lumicera, and participating UC specialty pharmacies. Members can receive behavioral health assistance through Learn to Live app and Live Health online. There are no major structural changes to the UC Care plan. UC Care has a large preferred provider network in California of over 62,000 plus Blue Cross network Anthem preferred physicians. More than 97% of hospitals and 92% of physicians across the country are Blue Cross Blue Shield providers. And there are preferred providers in 190 foreign countries. There is one major change for prescription drugs, and oral chemo drugs are now on formulary at max coinsurance of $200 per 30-day refill. For health savings plan members, The health savings account maximum contributions for 2023 is increasing. This is set by the IRS each year. The maximum health savings account contributions for individual increases from $3,650 to $3,850. Family increases from $7,300 to $7,750. Catch-up contributions for those 55 years old and over remains the same at $1,000. And UC contribution towards the HSP also remains the same. In-network deductibles have increased by $100 to $1,500 for self-only coverage and by $200 to $3,000 for family coverage. There are no changes to the out-of-network deductibles. There are no structural changes to the core plan. The core medical plan is a non-Medicare plan with worldwide coverage. The calendar year deductible remains at $3,000 per member. The out-of-pocket maximum also remains the same at $6,350 per member for medical and $12,700 for family. Preventative services are covered in full and not subject to the calendar year deductible. For prescription drug coverage, after you meet the deductible, you will have a 20% coinsurance to pay towards drugs. The only difference between the in-network and out-of-network drug coverage is that mail orders for a 31 to 90-day supply is not covered. There are no major changes to the UC Medicare PPO plan for the 2023 plan year. The calendar year deductible remains at $100. The out-of-pocket maximum remains at $1,500 for medical per member, but the out-of-pocket maximum for prescription drugs has increased from $7,050 to $7,400. Please note that you must use Medicare-approved providers. There are many services that Medicare does not cover. For example, acupuncture services, hearing aids, and some chiropractic services. Sometimes you may need to access services with a psychiatrist. If they do not accept Medicare, you can still have them as your provider as long as they are licensed providers. There are no major changes to UC High option for the 2023 plan year. The calendar year deductible remains at $50. The out-of-pocket maximum for medical remains at $1,050 per member, and the out-of-pocket maximum for prescription drug coverage remains the same at $1,000 per member. Accolade Health Assistants and Nurses will replace Anthem Health Guide as the non-Medicare PPO plan members' first point of contact with help with benefits questions, big or small. Members can ask health assistants and nurses questions like, is this procedure covered by my health insurance? What will my costs be? Where can I find an in-network pharmacy near me? What prescriptions are covered? What will I pay? Can I order this drug through the mail? Where can I find discounts? Can you help me find a doctor based on my needs and preferences? Can I get a second opinion on a diagnosis, possible surgery, or treatment plan? We know that UC San Diego employees have choices about where to receive health care. We also know you deserve nothing but the best. Your good health begins with convenient primary care. That's why we've expanded our network of primary care locations and included virtual options such as video visits. Our growing network now includes more than 650 primary care providers in San Diego, Riverside, and Imperial counties. During open enrollment, choose a UC San Diego Health PCP or one of our affiliate practices such as Perlman Clinic, One Medical, or San Diego Sports Medicine. No matter where you get your care, you and your family can access our nationally ranked specialty care and the most advanced technology and services. New for this year, you and your family have more options than ever because of our affiliation with Children's Primary Care Medical Group, which widens your access to pediatric care. You can make the switch to one of these plans if your current plan does not cover UC San Diego Health, providers, or affiliates. Open enrollment is the time to make the change. VIA benefits. Since 2014, UC began offering retirees who live in a state outside of California their medical plan coverage through UC's Medicare Exchange Program. VIA Benefits is UC's Medicare Coordinator Program for retirees living in a state outside of California. Each family member must be enrolled in Medicare. UC will provide an annual contribution for each covered family member under a health reimbursement account. The maximum contribution remains at $3,000. For these retirees needing to make changes to their dental, vision, or legal plan, you must complete a paper form. The form is called the UBIN 100 and can be found on UCNet. Non-medical plans. For dental, Delta Dental continues to be the vendor as our dental provider. There are no benefit changes for either Delta Dental PPO or Delta Dental HMO. UC continues to pay full cost for retirees eligible for full UC contribution. All other retirees with graduated eligibility will pay a portion of the premium. Vision insurance. VSP continues as the vendor, and there has been benefit enhancements for a primary eye care program for the diagnosis and treatment of some medical eye care services, including eye trauma and injury, foreign body removal, diagnosis and treatment of eye conditions, including pink eye, vision loss, and cataracts. There is a $20 copay for most diagnostic services and a $0 copay for retinal screening for people with diabetes. Please contact VSP for more information. The retiree rates for 2023 have increased by 4% with an average of less than $1, and retirees will continue to pay 100% of the premium. If you're currently enrolled, your coverage will continue for next year. If you need to enroll for next year, you have two options to enroll. You can go online to www.vsp.com/go/UC retirees or by phone at 866-240-8344. ARAG continues to be the provider of our legal services. They have added some benefit enhancements for alimony and child support, modifications and enforcement, annual accounting of guardianship and conservatorships, restraining orders, and have increased their general support hours from 4 to 6 hours per year. There are no rate changes for 2023. For accidental death and dismemberment, Prudential Life continues to be the AD&D insurance provider. There are no changes in premium and no benefits changes for the 2023 plan year. To enroll, you can either call 1-800-524-0542 or log on to UCNet to download their form. This plan is open throughout the year for enrollment. Pet insurance. Nationwide will continue as the vendor with exclusive plans with preferred pricing just for UC. The rates are based on species of animal and state of residence. There is no UC contribution, and the retiree is required to pay 100% through direct pay. To enroll, log on to www.petinsurance.com/UC or call 877-738-7874. Member ID cards. You may not think about your health insurance card until you, your doctor, or your provider asks you for your information. The appropriate ID card must be presented to obtain benefits for services. Every year, you should make it a point to find out if your plan will be issuing new ID cards. Over the years, I have found that many retirees and employees are carrying the wrong health plan ID card or no ID card at all. You can prevent being denied services by simply presenting the most updated ID card to your provider. All ID cards should be received by the first of the year. If you do not receive your ID card, please contact the plan directly. Open enrollment is the time to make changes every year. But if you have a qualifying event outside of open enrollment, you can change at any time. A qualifying event can be moving out of the plan service area, involuntary loss of other coverage, a marriage or divorce, or addition of a new eligible family member. Once you have a qualifying event, you have 31 days to make a plan change. Before I end, I'd like to tell you briefly about our Healthcare Facilitator program. We assist UC San Diego employees and retirees. We service a large population of active and retired faculty and staff. You can find our contact information here and on UCNet. Before you contact your HCF, take time to understand your benefits. Log on to UCNet, review your evidence of coverage booklets, and check to see if there's any plan limitations or exclusions. Call your medical plan. Your plan can answer questions about your coverage, authorization requirements, provider networks, and help you change your primary care physician. Contact your medical provider's office or the billing office. If you receive a bill, call them to make sure they billed your insurance. Listed on this page are resources you may find helpful. I've included the steps retirees should use when you're ready to review your open enrollment information. Everything you need to know about your health and welfare benefits can be found on UCNet. Annual open enrollment information, evidence of coverage booklets, and fact sheets can be found on UCNet. If you need to contact the RASC, I have listed their information here. To contact me, Ronisha Roberson, our contact information is here. Please keep in mind that there are only myself that assists over 30,000 employees and retirees, so there may be delays when you contact. If you're a retiree and not currently a member of the Retirement Association, I would highly recommend you become a member. The Retirement Association is how you can stay connected to the university and stay up to date with your UC San Diego community. They offer members a wide variety of programs and services. I cannot say enough about how you would enjoy and benefit from becoming a member. Contact Suzanne Chaffee, the Director of Retirement Association. I have also listed CMS, Social Security, and HICAPS information here as well. When it comes to Medicare and Social Security benefits and information, these are the experts to address your questions. Finally, I'd like to remind you to read your open enrollment booklet. Review the pre-recorded presentations by visiting the UCSD Blink page of open enrollment. Confirm your changes and make sure you receive a confirmation. The Medicare forms must be received by November 21st, 2022. If you're satisfied with your current health plan options, you are not required to do anything, but it is highly suggested that you log in to view your current enrollments. If you add any new family members, expect a letter from Unify HR in February requesting documentation to verify the eligibility of your new dependent. If you change plans, look for your new ID card in the mail and file your old card in a safe place. Open enrollment ends on Friday, November 18th at 5 p.m. Pacific Standard Time, and that is a firm deadline. And don't forget, your new elections are effective January 1st, 2023.